Patients with bipolar disorder are at a 2 to 3-fold increased risk of developing dementia over the general population. Now, of course, you might be wondering, what is this from? How do we pinpoint it? Well, there's no one factor, there's actually several. One of which is called neuroprogression. So in neuroprogression, the theory is that the more episodes of mania and depression one has, the more inflammation and oxidative stress they're exposed to, and of course, the more damage is done to those parts of the brain. Now, that is one component, but some of these components are actually modifiable. For example, lifestyle. We know that patients with bipolar disorder often are more likely to smoke, use substances, use alcohol, have diabetes, and have cardiovascular disease. So making sure you take care of that hypertension, making sure you're diligent with your diabetes treatment, and of course, eliminating drugs and alcohol from your life will be a huge help in preventing dementia. The other factor to keep in mind is that lithium may be neuroprotective, as we've said in previous videos, but things like valproic acid might not be, and they might actually be detrimental in the long term, although beneficial, like I said, in the short term for treating acute mania. But I think it's very important that we keep in mind there is this increased risk in general with the diagnosis of bipolar disorder.